you haven't met yet, my name is Kimberly Flores. I'm a board-certified nurse practitioner, certified nutritionist, and the CEO of Sabosany Health, which is a wellness health coaching company. We come here every month, and what I do is I spotlight local ingredients from our very own organic gardens to show you how you can utilize them and make really, really tasty meals. So the spotlight for this month, we are using beet greens from our gardens, fresh thyme, and not pictured because it's still in the fridge, but our chocolate mint. The plan was to use strawberries, but they gave up on us and we kind of ran out. But we did have strawberries in our garden, just so you guys know. So we're using strawberries, but they are not fresh from our gardens. The big one that I want to focus on this week is I keep wanting to call them collard greens because that's what they taste like to me, but the beet greens, because they are so nutrient dense and they really are versatile. So we're going to be putting them in a quiche today, hence the brunch theme. It's got eggs, so technically breakfast, but you could eat this for any meal of the day. So as you can see, I've been sitting here as we're talking. I have sauteed the beet greens and the onions inside of the bacon crust, but there are gluten-free flours that you can use, or you can do like an almond crust flour. Of course, any modification you make to the original recipe will modify the taste. It might modify the texture, of course, but for those who have food allergies or sensitivities, you can easily modify these things. Some of the other modifications that you can use if you don't want to eat pork or bacon, you don't eat meat at all, you can replace it with seitan. That's probably going to be your best alternative. That's vegetarian. Or you could omit the meat altogether. It still has eggs, still has cheese, still has milk. You can use a milk alternative for some people who are lactose intolerant, where you may tolerate cheese, but maybe not the milk. Again, you can use a milk alternative. It's going to alter the taste and texture just a little bit. What I find is that almond milk is the best non-dairy substitute to use for recipes like this, but it's always going to give it a sweeter flavor because almond milk is sweeter than regular milk. So what I'm going to do now is put everything inside of these crusts so we can get them cooking, so we can all eat and drink mimosas. Any questions so far? No. Okay. So the trick to this, honestly, you could really do it any way you want. But the way I have the recipe set up is you are going to sprinkle the sauteed beet greens and onions at the bottom base of the quiche. And I doubled the recipe. We're going to make two so that everyone can eat a full-size piece this time. Let me just divvy all this up. And you're going to like layer it as such. But really, if you just want to dump it all together at the same time, you could do that too. This just kind of makes it a little bit more even. It's so it's a pre-made crust, and you have to bake it beforehand to brown it a little bit, and then you finish baking it with all the ingredients inside. Okay, so this is actually a good teaching point. So these were pre-made crust. Whether you make the pre-made crust or you make it yourself, you can see that it fell a little bit short on the rim, so it didn't hold the egg. So what's going to happen is when this cooks, this edge might fall apart. It might look more like scrambled eggs and quiche, but it'll taste good. So I decided to pair this meal with strawberry mint mojitos. Did I say mojitos? Because I meant mimosas. So what you're going to do is grab whichever champagne that you prefer, or lemon lime bubbly. So I have some lime sparkling water right there. Then you're going to do, so instead of a regular mimosa where you do orange juice, we're going to do strawberry nectar. And then we're going to top it with the strawberries and the mint. Now, there's a couple of different options. The way the recipe called for is to put like the whole thing in because it's like a garnish as well. You could also, again, you could pick the leaves and kind of muddle them up to have it like actually in the flavor of the drink. It's up to you guys. For the sake of me not making a huge mess and making it pretty, I'm just going to garnish it with the mint, okay? And, so the ones that we're using right now, the greens and the beets, and I accidentally chopped up all the beets. I wanted to show you how big and long they are. They're elongated, so they're not perfectly round like a regular, like, which hence the name cylinder. Whereas the ones that we harvest in the fall, they're a little bit more round, and the taste of the greens, they look different and they taste different. So the beets that we're harvesting right now in the spring have a little bit of a sweeter, softer texture, whereas the ones from the fall are a little bit more earthy. And the greens are a little bit more bitter, whereas these greens are, I think they're incredible. They remind me of collard greens. So even if you're just sauteing them in a little bit of olive oil, salt, and pepper, they're very buttery, nutty. They go well with pretty much anything. And chop the stems. They're like mini celery sticks. The way they're formed, they're just really tiny and they're purple. But you can eat them as a snack. You can dip them in ranch dressing. I put them in tacos. I chop them up, put them in salads. Like they're really, really good. They taste just like the leaf, except for it's a little bit more crunchy. So it's a really versatile, not just the beet that we think of eating, the root, the vegetable itself, but the greens that we're using. And that's why I wanted to highlight them, because a lot of times people will throw the greens out, save the beets, and I'm like, you're missing the best part. Not that the beets aren't great, because they're great. You roast them. They taste amazing. It's one of the few foods that my husband will actually eat. So I cook them as much as I possibly can. Some of the other benefits of beets. I mean, it's such a versatile food. It is a root vegetable, and that means it's grown in the ground. What a lot of people don't know is the nutrient content, of course. I'm a nutritionist, so I have to talk about this part. It is packed with so many micronutrients. Two of the big ones that people wouldn't think about coming from a vegetable is iron and calcium. When we think calcium, we think milk, yogurt, cheese, things of that sort. Per 100 gram serving of beets, you're going to get about 117 milligrams of calcium. So like not a small amount of calcium that you're getting from vegetables. And that goes back to, this is what the whole form of this beet. And you see how it's not perfectly round? It's almost like an oval or a sphere or a cylindra, get it? Kind of similar. So yeah, so between these two, between the actual fruit itself and the greens, the darker the green leaf, the more iron you're going to get out of it. So beet greens, collard greens, kale, spinach, those are all really iron rich foods. Some of the other micronutrients in beets is magnesium, manganese, phosphorus, copper. This is really like a multivitamin packed into one. A lot of these things you are going to get from a multivitamin, but when you get it from a whole food source, a lot of times it's going to absorb better. So I'm a fan of multivitamins. I tell all my patients, all my clients to be on one because our soil is over-farmed, and even, with the organic gardens and everything that we're doing, the soil now just isn't like it was 30, 40, 50 years ago. It's nutrient depleted because the turnover and over farming and things of that sort. So a lot of us do need multivitamins, even if we're eating whole unprocessed foods. We are spoiled though, because our gardens are local, they're small, they're tended to by farmers. So they're going to be on average a lot more nutrient dense than anything you're going to get at the grocery store. And I know I've talked about this in previous classes before, but one of the other sides to that too is when you're going to a grocery store, they're picking them before they're even ripe. So it's not the fruit or the vegetable is not optimal peak because they have to pick it and it has to get to the grocery store before it rots. Obviously, because if it rots, they don't sell it and they lose money. And that's another reason why the foods that we grow here, like if you take a strawberry from the store and then take a strawberry from our garden, it's like night and day difference, like completely different. They might look a little bit the same, but the taste, it's juicier, it's sweeter, it's just got more of a flavor than one that you're going to buy at the grocery store. And it goes the same way with like going to a farmer's market. There's a ton of local farms in the area, but of course I'm going to talk up our local gardens because we have them and they're great. And if you could sit for hours at a desk and study, but like if you just go get your hands dirty, and I actually read this yesterday, which I read it somewhere previously, going outside and getting your hands in dirt. The mycobacterium in the dirt itself, when you smell it, it helps your brain release serotonin. So the action of getting your hands in dirt, even if you're not actually doing anything, just like stick your hands in dirt, it makes you happy apparently. So when mom and dad say don't go outside and don't get dirty, tell them that it's good for your health. Just wash your hands when you come back in. The other thing too is after 24 hours of picking the whatever it is, it starts to lose its nutrient density. So this morning I saw a really cool trick I've never heard of before for people who like homestead and live in areas where through the winter they're not harvesting food. If you take a bin, fill it with a layer of sand, and then you put whatever the root is. He was using carrots in this instant, and I was like, oh, this is usable because we grow carrots here and we have plenty of them right now and they're amazing. Put a layer of carrots and then a layer of sand. Leave all the tiny little, the little hairy legs, like the little tiny, leave all of that intact, cut the greens off just like you said, and just put the actual vegetable in. A layer of the food, a layer of sand, layer of food, however big your container is, and it'll last up to 6 months in a cool, unrefrigerated spot, like not out in the sun, obviously. I'm like 6 months, that's really good. And you could do it with potatoes. I mean, a lot of these things like potatoes, onions, really any root vegetables, like you said, they preserve really, really well in the right time and place and temperature, of course. So yeah. With any of a seedling that has a green, like beet greens, you can eat them as seedlings as well as a microgreen. And they're still very, very nutrient dense. Or at any point, the video I was watching, this dude, he showed a video of himself throughout the growing cycle of the beet greens, eating them at all points. So right as they bloomed and the seeds, the tiny little seedling and the leaves were coming out. And then when they were like half the size and then full size, he was pulling them and he was eating them. There are so many good bugs in the soil that our guts need. And I know because I do my research and I prescribe the probiotics to people, but if you've ever like gone shopping for probiotics, there's usually a soil-based probiotic. I want to say it's the Saccharomyces boulardii strain that comes from dirt. And that goes back to the importance of eating whole foods, because when you're eating whole foods that are getting exposed to these bacteria, yeah, we rinse them off with water, but we're still at some point, because they're microscopic, it is impossible to make this food sterile, right? But if you're getting something that's boxed and processed from the food that's never been exposed to these bacteria, that's why the bugs in our gut are becoming less and less diverse, our counts are going down, and that's affecting our health. The health of our whole entire organ systems, everything in our body starts in our gut. Millions upon millions of even viruses, protozoa, there's certain parasites, bacteria, there's a lot of things that live within us that are good for us. They sound scary, but our bodies are an ecosystem just like the world is. And it requires tiny little things that when we try to make things fast, easy, and cheap, it affects us. Every tiny little change affects us. The GMO and just creating lots of things that never existed before. Yeah, so we have a central nervous system, which is our brain and our spinal cord. And then we have a enteric nervous system, which is all of the nerves that are within our intestinal system. It attaches from our intestines outward. And so the way I explain it, and I used to talk about this all the time, especially with people who have like irritable bowel syndrome, where if they're stressed about something, it affects their gut, whether they get really constipated, whether they get nauseous and they throw up, whether they get diarrhea. Sorry, TMI, I know it's a cooking class. But basically how it works is there's a super highway between our brain and our gut. Think of it like a 12-lane highway where just always cars driving up and down, traffic never stops 24/7. And so every thought that we think affects what's happening in our digestive tract. That's why, like, if you get nervous for something and you feel like you have butterflies in your stomach, that's because you're thinking something and it's affecting your stomach and your guts. That's why when another big one is like, if you go through a traumatic experience, I'm talking like a car wreck or something, your body is going to, your brain is immediately going to shut down your intestinal tract, because that is essentially the last life-saving thing it needs. Like, you don't need to be digesting food when your body is more focused on keeping your heart beating and keeping your lungs breathing, if that makes sense. So people who go through something where they like require CPR or something like that, they are usually wrecked with constipation for months and months and months, to the point where they have to completely retrain their bowel, because the brain is really smart and will shut that off and be like, you don't need to digest food right now. It's not important. You can get away with not eating food for at least 7 days. But right now, if your heart doesn't pump and you don't breathe air, you will die within a matter of minutes, 3 minutes to be exact. So it's true. It's a super highway. It's a second brain. Dare I say, it's more important than this brain, because 90% of our serotonin and dopamine come from our intestinal tract. A lot of people don't know that. So when you go to the doctor and you get prescribed an antidepressant, they are giving you medications that are going to manipulate what's going on up here. But if you've ever been on an antidepressant or anti-anxiety medication, you'll know that one of the top side effects is constipation. So why is a drug that's supposed to be affecting up here giving you issues down here? And that's because a lot of the hormone production is actually coming from our guts. And that goes back to the types of foods that you're eating affects how you feel. When you eat something that, disregard the bacon and the eggs that we're about to eat, if you eat something that's like really, really high in fat, super processed, like, I don't know, let's say you down a pint of ice cream and a pack of cookies. How do you think it's going to make you feel an hour later? I mean, you're going to have the sugar rush, right? Then you're going to crash and you're going to feel groggy and you're going to feel just low mood, low energy, versus if you eat a salad and some grilled chicken, it's going to give you nice, clean, sustained energy. It's not going to put you in a bad mood. And so I'm very honest with my clients. I'm like, if you eat like crap, you're going to feel like crap. Like if you put a little bit of time, energy, and attention into what you're eating, it's going to completely change your mood. And I know I'm going off on a tangent, and I do apologize, but like, I think we are too quick to go to the doctor's office and ask for something like an antidepressant medication. And not that there's a time or a space, but there is so much we can do around what we're ingesting and how we're moving our bodies that can prevent us from needing to get to that point. And I know that from personal experience. I've been very transparent on social media about struggling on being on Adderall for many, many years, and coming off of the Adderall that I so needed for so long. And I'm just embracing my ADHD and all my glory. Hence the reason I'm messy and clumsy, and here we are, and that's okay. But it threw me into a really deep depression. And this was recent. This was just last year. And it was so hard. And I had to get myself to a point where I'm like, either I'm going to sit here and feel sorry for myself and just call the doctor and be like, put me on medicine to make me feel happy, or I'm going to really work through this, and I'm going to work on my well-being like it's my full-time job. And so I was very meticulous about the food that I was eating. And when I say what I was ingesting, I'm not just talking about food. I was very careful with the music that I listened to. I had to stop talking to certain people because they were really, really negative and they put me in a bad mood. I had to change the way I was working out. because I wasn't walking. So I just needed to go out in the morning and get sunlight, and all those tiny little things pulled me out of the depression. And again, I'm not saying there's not a time and space for medicine, because there is, but there's a lot we can do to help ourselves before we get to that point. I always say, make a mess, play with your food. That's how you're going to learn, right?